Chris Robinson here. This is a short video about the patient entering post-treatment void information into the uri-log.com system. The patient's entry of their void event information is a primary driver to enhancing patient commitment and compliance to the PFMT regime and potentially reducing the number of days to continence. Men generally will engage well with tasks that involve measuring, counting, scoring and monitoring. This is a self-motivating activity that also can positively influence their locus of control. Additionally, the availability of the patient's information to the health professional immediately following catheter removal or treatment startup provides them with an early intervention opportunity to tune or reinforce individual patients' PFMT treatment regimes. To communicate changes to PFMT regimes, uri-log.com provides a direct and secure messaging service between the health professional and the patient. The entry of void event information starts immediately after the catheter is removed, and the date and time of catheter removal needs to be entered in the Record My Treatment type details page before the void and event information can be entered. The patient logs into uri-log.com and the patient access page will open. The patient now selects Record My Void Event Information. The patient now clicks on Add Void Log. The Add Void Log page opens, revealing a number of data entry options and associated hover help. The patient now enters the date of the void event. The patient now enters the time of the void event. Next, the patient enters the measurement type. Three types in the drop-down box are estimate, container, and padway. Immediately after catheter removal, the measurement will most likely be padway. The patient now clicks on padway. The patient now clicks on Awake Asleep and enters a response to indicate if they were awake or asleep prior to this void measurement. Please note the hover help. The patient now enters the dry weight of the pad in milligrams. The patient now enters the wet weight in milligrams. The patient now goes to the void delay box. Note the hover help. Initially, no response is needed, but as the void measurement types move to container and/or estimate, the amount of minutes delay time to a void event becomes an important motivational measurement. The next box is estimated leakage. There will be situations where an uncontrolled small leakage occurs, particularly as the patient progresses to void measurement by container and estimate. It is important to estimate the volume and the circumstance in which the leakage occurred. This provides the health professional with an understanding of the effects of the PFMT and provides an opportunity to adjust the regime accordingly. The next entry relates to the previous leakage volume, and if there has been a leakage, the circumstances can be recorded here, and this is reported on in other reports. Note the hover help available. The next entry provides for a brief comment on the patient's general activities prior to the void event. Note the hover help. The void event entries are now saved. Entries can be edited or deleted on the void summary record page if mistakes are made. When the patient's urinary system improves, a mix of the measurement types will change to include container and estimate. If these are chosen, the page will change to reflect that measurement type. All other information entry boxes remain the same. Whenever a padway measurement method is recorded, the value of days to continence will not be shown in the reports. Days to continence is defined as the number of elapsed days since catheter removal to the last padway day plus 1 day. When achieved, the value in days will be displayed on the All Voids Log report with a message to discuss with the health professional. Please note that while it is very important that the patient records all void event information in the first 2 to 3 weeks after catheter removal, the frequency of recording can be reduced on a case-by-case basis thereafter. This can be discussed with the health professional. That's all for now.